podium to make his remarks.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, good afternoon. I welcome you to the national briefing of Wednesday, 29th April 2020. Yesterday, we further elaborated on the key aspects of Mr. President's brokers and reiterated his determination to lead us to a victory over the pandemic. This has informed continual dialogue and experience sharing with development partners and friendly countries. The reassuring telephone conversation between Mr. President and the President Donald Trump of the United States of America, during which they exchanged ideas on emergency responses, further highlights the global response to this pandemic and underscores the collaboration between all nations in solving the problem. We therefore welcome and appreciate the offer of ventilators and other items by the American President. In line with Mr. President's directive in paragraphs 34 to 41 of his brokers, the Presidential Task Force has developed sector-specific guidelines. The gradual reopening of the economy will span a total of 6 weeks, broken into 3 tranches of 2 weeks each. The first strategy is designed to reduce the pains of socio-economic disruptions while strengthening our public health response, which would ultimately reduce the recovery of our economy and provide succor to the poor and vulnerable. To underscore the collaborative efforts with subnational levels of government, they are encouraged to provide leadership in engaging relevant associations responsible for various sectors, e.g. market associations and transport unions, for orderly and effective implementation. Similarly, I want to emphasize the need for security agencies to strictly enforce these new measures that have been put in place. Following the pronouncement of the President, it has become necessary to provide initial clarifications for Nigerians on some of the new measures, such as the overnight curfew, interstate travels, and related matters. Specific details will be provided shortly by the National Coordinator. For the avoidance of doubt, the following clarifications are provided. The overnight curfew is applicable nationwide from 8 p.m. to 6 a.m. daily, effective Monday, 4th of May, 2020. Interstate travels are banned except for the movement of goods, agro products, petroleum products, essential services, ECG, such as directed by Mr. President. Third, the management of various offices, premises, and businesses that will be gradually reopened are mandated to ensure that the following preparatory steps are taken. A, fumigation and decontamination. B, arrangement made for physical distancing. C, provision of hand sanitizers and hand washing facilities. D, application of the policy of mandatory use of face masks. E, provision of thermometers for temperature checks. F, consideration must be given to persons living with disabilities while making all these arrangements. G, increased communication with staff on COVID-19 and the measures put in place. And H, any other measure may be peculiar for the organization or the sector. 4, mass gatherings of more than 20 persons outside of workplace is strictly prohibited. 5, controlled access to neighborhood markets and locations of economic activities will be enforced. 6, mandatory temperature checks will be conducted in public places. 7, social distancing of 2 meters to be maintained between people in workplaces and other public places. 8, all passenger flights remain under bar. And 9, mandatory supervised isolation of persons arriving from outside the country for at least 14 days. State governments, in collaboration with security agencies and relevant trade associations, are strongly advised to ensure that these measures are strictly enforced. I must emphasize once more that the easing of restrictions and introduction of revised measures do not amount to the end of the battle against COVID-19. Indeed, it signifies the need for more vigilance, stringent compliance, so that we are not lured into complacency capable of diminishing the progress we have made so far. In furtherance of tackling the situation in Kano, the technical team of public health experts sent by the Presidential Task Force has begun the evaluation of the situation in the state, working in collaboration with the state's team. I'm pleased to inform you that the operationalization of the laboratories in the Aminu Kano Teaching Hospital and Bayero University Kano will considerably improve our response to the pandemic in Kano State. Additionally, 50 trucks out of the about 200 meant to be sent to Kano of assorted grains have been sent to Kano and due for delivery within the next 48 hours. The Presidential Task Force appreciates the cooperation of the governor and the medical team in Kano. I need to, at this point, mention the role of research in this exercise. We must encourage our local scientists and deepen our capacity for research. There is a huge role for all relevant research institutes to play at this time. The Federal Ministry of Health is coordinating the process in conjunction with the National Institute for Medical Research and the Nigerian Institute for Pharmaceutical Research and Development. We have received information on domestic and international claims about emerging inventions on COVID-19. These are most welcome, but scientific validation process and protocols will have to be followed. We are open to all options for the good of humanity. The Presidential Task Force appreciates the feedback, reports and suggestions and constructive criticisms received from Nigerians on its activities. Through the WhatsApp platform deployed on telephone number 070-535-36666. We look forward to more interaction to enable us to improve on our work. Once again, we urge everyone as citizens to take responsibility for their actions so that we can collectively overcome the COVID-19 scourge. I would not fail to reiterate the need for Nigerians to please continue to adhere to the let-down adversaries. Once again, I appreciate the members of the press for your patience and our frontline workers for your invaluable contributions to the success of this war. The Presidential Task Force continues to receive donations in kind from different organizations and groups to support the fight against COVID-19. This morning, the Ansar-Uddin Society of Nigeria donated assorted food items. The Full Gospel Businessmen's Fellowship International Nigeria has also donated the sum of 10 million naira. The Presidential Task Force, indeed the nation, appreciates these gestures and assure the donors that the resources will be judiciously applied. In addition to the updates by the Minister of Health, the DG, Center for Disease Control, and the National Coordinator, ministers may also update you if necessary during this briefing. I now yield the podium to the Honorable Minister of Health to update you all. Thank you.
Can you shift a little bit here? Thank you. Yeah. The Secretary to the Government of the Federation, Honorable Ministers here present, Directors General, Directors, ladies and gentlemen. As of today, the 29th of April 2020, 1,532 people have been confirmed to have COVID-19 in Nigeria. A record 825 tests were done, with 195 new cases identified, a high number that is distributed as follows: 80 in Lagos, 38 in Kano, 15 each in Bauchi and Ogun, 11 in Borno, 10 in Gombe, 9 in Sokoto, 5 each in Edo and Jigawa, 2 in Zamfara, and 1 each in Delta, Enugu, Nasarawa, Rivers, and the Federal Capital Territory. 255 persons have been successfully treated for COVID-19 and discharged to go home, and sadly, 44 fatalities have been recorded. The increasing figure of confirmed cases underscores the ongoing community transmission, which is a major challenge and again necessitates a call on all of us, all citizens, not to take COVID-19 lightly, but to take ownership of initiatives for non-pharmaceutical interventions with strict adherence to public health advisories, which is to maintain social distance, practice hand and respiratory hygiene, avoid crowded places, and wear your mask or a face covering when you leave your house. These and other related measures are critical and an integral part of the strategy to ease restrictions as from 4th of May. I urge community leaders and traditional rulers to help to ensure compliance in their domains, because failure to comply can have undesired effects. Another pressing urgency is the need to provide and prepare isolation centers and more bed spaces in all states of the Federation. I wish to apply to each state authority and Federal Capital Territory to give first-line attention to this requirement in order to meet expectations and obligations. As testing ramps up, the need will become more and more obvious. It should therefore be prioritized so that we are not taken by surprise. I should take the opportunity to request elected distinguished senators, honorable members of houses of representatives and assemblies to also get involved in this effort to ensure compliance, to participate in disease surveillance and notification efforts in their constituencies, and to actively support the drive to rapidly increase bed spaces for isolation and treatment in their states. I shall also strongly urge those who test positive for COVID-19 to cooperate with the directives of authorities on isolation so as not to constitute a risk and a cause for public concern. We have completed plans to start training and capacity building of much needed intensive care workforce for various parts of the country. I am pleased to report a fruitful interaction of the Federal Ministry of Health delegation to Kano yesterday. They were well received by His Excellency the Governor and have been able to conduct an appraisal of the situation and to start working on outlines of providing technical support to the state COVID-19 task force in several aspects, as well as also planning capacity building for the frontline health workers. They also met with many influential community leaders who all expressed willingness to support the effort of the government. A full report from the team is yet to come. I shall, as usual, use this opportunity to call on our healthcare workers to continue to render service to our people while adhering to laid-down standard infection prevention and control measures. An advisory on case management has been developed and is accessible online. NCDC has also released guidelines on the management of the dead who fall victim to COVID-19. I shall close by, as usual, reminding you all that arresting the spread of this dangerous virus requires our individual and collective effort, and reiterating our public health advisories to stay at home, to avoid crowds and large gatherings, to practice physical distancing by strictly maintaining a distance of at least 2 meters between people always, to use non-contact greetings, and the elderly and anyone with pre-existing medical conditions such as hypertension, tuberculosis, cancer, chronic respiratory disease, diabetes, cardiovascular disease should not attend large gatherings or crowded places and should avoid receiving non-essential guests at this time. Also use your masks and face coverings over your nose and mouth if you must leave your house. Resources and real-time information on COVID-19 can be found on the social media handles of Federal Ministry of Health and NCDC. Thank you for your attention.
Chairman of the Presidential Task Force, honorable ministers, ladies and gentlemen of the press, good evening. Today I've chosen a slightly different topic as usual, given the time of the year it is. It's one about sacrifice. We all know that this is the holy month of Ramadan, and it's marked by the observance of fasting. It is a season that encourages our Muslim brothers and sisters to unite and break their fast together every day. It is also customary for our Muslim brothers and sisters to go to mosques for congregational prayers and to listen to sermons. These are values and practices that I know that every Muslim holds very dearly. So this must be a very difficult year, because we are asking that Ramadan be done differently for a public health reason. So it's in recognition of the immense sacrifice being made that we published an advisory on how to do this safely during this period of Ramadan. And if you look at our website, www.covid19.ncdc.gov.ng, you'll see a new advisory on how to manage this, at least from the public health perspective. But I really want to also recognize the huge sacrifice it takes to change a way of life and change your day-to-day activities of something that is held very dear for a public health reason. The other group of people I'd like to mention today are healthcare workers. Across our country, many people are away from their families. Many people have been away from their families for 6 weeks to 2 months. They work very hard with no end in sight at the moment. But yet they have no options. Every morning they have to wake up and continue pushing. So wherever you are today across Nigeria responding to this outbreak, whether you're in Kano or in Abuja or in Lagos, in Kogi, in Cross River, I'll ask you to persevere. Your work will see the we will see the light at the end of the tunnel. Yesterday after work, I spoke to a number of people in my own team. that had sadly become infected themselves as part of the response in the line of duty. I spoke to them. We ended up in a situation where they were encouraging. I called them to encourage them, but they ended up encouraging me and encouraging this PTF to keep pushing, that our work was so important for the future of our country, and they wanted to keep at it. So even though they're isolated and some of them in hospitals, they're on their laptops working, contributing to the response. They say it's better to do that than to sit idly, watching TV or thinking about their fate. So today I really want to end this very short set of comments, thanking all of them, whether you're working clinically, whether you're a public health surveillance officer, whether you're a driver, whether you're an ambulance driver or driving a pickup, or any part you play in this response, not to give up. We need all of us, we need all of you to keep pushing. And my final words really are to their families. Many of them have families at home, knowing every day their husbands, wives, children go out to do contact tracing, to manage patients, to drive vehicles, to drive ambulances, that we're in this together. And we'll do the very best to protect you from harm and do the very best to get our country back on track again. Thank you very much.
And the chairman, members of the Presidential Task Force, ladies and gentlemen of the press, good afternoon. Before I go through the details of the lockdown protocol, I would like to first of all start by talking about our donors, particularly those that have been helping in the distribution of palliatives and those that have contributed in significant amounts for the fight against COVID. First of all, I would like to continue to encourage donors to ensure the safe distribution of palliatives across the country. It is particularly important that donors ensure strict physical distancing, ensure that their personnel are trained on basic health and safety protocols. This will stop us from having situations where we are potentially putting persons at risk of transmission of COVID. From the point of view of persons that are positive for COVID, again, I would like to urge these persons to please present themselves to clinical setups. The key symptoms are fever, which occurs in about 80 to 90% of cases, a cough, which happens in about 2/3 of cases, and a shortness of breath. There are other unusual symptoms such as loss of smell and taste associated with cold-like symptoms. In these situations, it's particularly important that we take measures to move persons out of the communities and into care so that they can be looked after properly. We need to take personal responsibility of our health, but we also need to take responsibility for the health of our communities. I would like to, before I go on, I would like to acknowledge the contributions of the following: MTN, UBA, Friesland, Union Bank, Food Relief Fund, and the Ansaruddin Society. We're very grateful for your support. In terms of the details of the lockdown protocol, the Secretary to the Government of the Federation has already outlined some of the guidelines we have in place that haven't really changed remarkably. And I think the most important thing I wanted to emphasize is, even though we talk about easing the lockdown, in actual fact, we're not really easing. We're just shifting from one set of interventions to another, because we are really still far from controlling this epidemic, and we need to continue to work hard, all of us, to make sure that the pandemic resolves. So, first of all, the issue of curfew. Effective from the 4th of May, as Mr. President announced, there will be an imposition of overnight curfew nationwide from 8 p.m. to 6 a.m. General movement outside the curfew periods People may go out for work, to buy necessary food, and for exercise. But we are strongly advising persons to restrict themselves to their local government areas, except for those that live in metropolitan areas where this will be very difficult. Unless, of course, you are going out for critical reasons such as healthcare and work. For interstate travel is restricted to only those involved in the supply chain and services such as goods, agricultural products, petroleum products, courier services, relief items, etc. And we'll provide that detail.